this is quite interesting. So what I'll now do is I'll ask questions. I would respect that if you can give short, quick answers so that we can ask more questions, probably to have better perspective on a lot of other things that the fake news theories involve. So what happened is that earlier some doctor from UK went on to say that there is this herbal tea that you drink, Sana tea, olive tea, olive tree leaves, and what else, and I'll give 20 million rupees worth of, to anyone who says that they've had it and they've not been cured. And then came these, self-administered COVID tests, and then came holding your breath for some seconds, and you can test whether you have COVID or not if you cough. And then came the news of smoking and the use of tobacco to be increased. And then came the news that probably tobacco industry is doing a propaganda to promote their products in this time, and hence shisha and those people who are having shisha or who are smoking are not getting sick. So it kept changing. And similar was the stance by many organizations because there was not enough information about the virus. And since it is an RNA-based virus, so people were knowing. So the stance from WHO and other organizations was changing as more and more developments were coming, more information was coming. What is the reason that this spreads so quickly, so easily, and we all like it that, let someone be cured. Everyone would share on WhatsApp. You were referring to this being a problem of young people. Elderly people do that because they think they're probably taking care of their loved ones while spreading this news. So my question is to Dr. Schirch to start this with, that what is the role of fake news and conspiracy theories, especially with the local political agendas, as you pointed out, as Fasi just pointed out, and others. So what are those fault lines or social fault lines, if I may? And we've seen, the Shia Sunni and Tablighi Jamaat being accused of it. Similar example that he gave for India. So why do we create such news, whether it is the quick recovery ones or whether it is that attaching a sectarian ones? And how is it best? What is that solution? I know it's a long question, but what is the solution to curtail it? What is the role that the people can play not to spread it further?
Okay, that's a big question. Thank you. So I'll talk mostly about the United States because I actually think that the dynamics in Asia are very similar in terms of our white nationalist, white supremacist groups here in the United States, seeing this as an opportunity to further polarize our society. Obviously, the US, we've had polarization and division for many centuries, actually, because of slavery and the civil rights movement and the ongoing struggle for racial justice here. So now white extremist groups see it as an opportunity to further polarize people. So they are actively spreading disinformation to the anti-vaccine, pro-holistic health community about, miracle cures as well as anti-vaccine messages, because they're trying to draw in that crowd, the anti-vaccine crowd, which is also often concerned about healthy eating. So it's not all terrible stuff, but they are directly sending messages to that community to try to pull them in. The other community they're trying to pull in is the anti-technology. The people are concerned about 5G networks, and they were concerned about this before COVID-19, but now they're piling on these stories, and the things that were small divisions in society before, they're creating a unified narrative that the pandemic is allowing them to get away with. That as Dr. Taj said, it's compelling. People are anxious, they're depressed, we have no ability to figure out our future. People are clinging to any sort of simple answer. And extremist groups often come up with these unifying messages that pull together really diverse concerns into one big conspiracy. What can we do about it? I think the countries that are doing the best job have a very strong health sector that is putting out information every single day. They do a webcast, they talk to the public, they explain the latest research, they give the guidance, they give information. Here in the United States, in New York, for example, the governor was giving public addresses every day. Very compelling, people were watching, and it is the most effective thing, I think, to combat this information. Not all countries have a health sector that can do that, And that's what we're trying to figure out now in terms of a development agenda for UNDP and USAID and others. How can they get that authoritative health voice that is separate from the government? As you see in the United States, our health sector is at odds with our government. The president undermines the Center for Disease Control. So that's partly why we have such chaos here. Thank you.
Thank you, Dr. Schirch. So, Humaira, your points, what can be done for controlling this menace in Pakistan? And yeah, what is the government's plan around it? Great thing that Dr. Schirch said is more communication. I believe you guys are already doing that. Every day there is these news conferences happening.
Well, I think the guideline was given to us as Muslims 1400 years ago by the Prophet Muhammad sallallahu alaihi wasallam. He said that don't forward the news a lie, like if you without investigating. Don't forward the news without investigating. So he said, Urdu mein I will say, किसी शख्स के झूठा होने के लिए काफी है कि वो हर सुनी सुनाई बात को आगे बयान कर दे. It's enough for us to realize that a person is lying, that he's conveying the message of somebody else without verifying. So how to develop the ability of youth, first, to verify the news that they are receiving. So I talked about creating the immunity among the youth from extremism and terrorism. Same is the case that you have to develop the immunity among youth to against fake news. So how? It is through education, through teaching them ethics, through teaching them how to sift right from wrong. And it's not necessarily through the educational curriculum at schools. Education can be done by the media, by the social media platforms, by reliable people like you, Fasi. You can think of something creative where the youth is trained to see through things. I think Nordic countries set a very good example. They have established a system where they are training their youth to sift through the information that they are receiving. And Umar said something really amazing, which I experience every day. If I search something and then I'm swarmed by information. For example, for me as a counterterrorism person, I have to look for narratives. I have to look what other countries are doing. Then I start receiving strange kind of messages on my mobile and my laptop, which I don't want to see. So it's really, I seriously, I never planned to join Al-Qaeda or ISIL, but still you are bombarded with information that you really don't want to get involved with. So what government can do is that government, first, we were thinking of putting crawlers by PTA where you can take down the hate material, but I think it will affect the freedom of expression in the country. And also where we launched this app, Surf Safe, who will look at the content? Because you can have the data mining thing done, you can have the, I think technology people are more aware on how to sift through data, but for the government, it's an expensive exercise to undertake, to take down the information which is not true. So I think the responsibility lies with the social media and the big Facebook, Twitter, that they should establish internal mechanisms where the information which is reported as fake, sometimes they say it's not representative. So I think for issues like health crisis like COVID, there are systems that they can put in place to control spread of fake news.
Thank you, Humaira. So, Dr. Taj, I'd ask you this. So, when something trends on Twitter, and if even you put up a counter narrative, even if, for instance, I shared something which was trending, and now the counter narratives had taken down the trend, and I've shared that piece of information on WhatsApp, it has gone viral already. And from WhatsApp, it goes into conversations over SMS messages. And many people in Pakistan were not online, whether from the remote areas, where rural areas. Someone put in a question that many of our religious leaders or people who are very practicing Muslims are not very much aware or very confident that this even virus exists, right? And that source, which was once probably a fake news, has been taken down, but is still spreading. A good part both said that in lots of awareness campaigns to train the youth and lots of communication by the government to make sure there is one authentic source. What else do you think can be done to control this spread?
So I think one thing which it's important is that so there was 2 years ago a paper published by researchers at MIT where they looked at 11 years worth of rumors spread on Twitter. They looked at around 126,000 rumors, 3 million people, and they saw how it spread. And lies spread faster than the truth, right? Which means there's what is inherent in the fake news that makes people share. So one thing, all of our efforts are on debunking. So one, I think we have to go on pre-bunking, right? Which is somehow we have to stop the person reading it, let those beliefs get rooted in their mind. Once they are there, sharing any counter narrative is not as productive because the effect has already taken place. So at the moment, a lot of efforts that we do are debunking, which and giving information, which we know what are we're trying to target the system to, slow thing, but that system doesn't really operate in us. So we have to somehow get into this fast thinker and somehow train that fast thinker part of our brain to. But I think the thing is, why would people share? Because I think this is an important question, right? Why would we want to share this stuff? So I would just share like 3 things on it. One, and there's a lot of work again done on this. There's a brilliant book I would suggest people to read. It's called Contagious by Jonah Berger. He's a professor at Wharton. He's looked a lot into, well, what makes things go viral. And there are 3 things for fake news, especially, which I think are important. One, it's something called social currency. What we would share stuff that would make us look good in the eyes of the people with whom we have shared it. It's some sort of a status. So social currency is that one thing which makes people spread something, right? If I share something, if I share a cool cure for COVID, it makes me look good, right? And I gain this social currency. The second is stuff that goes viral elicits some sort of an emotional reaction. It would be fear, it would be anger, it would be joy, right? Disgust, anything that gets this emotional reaction out from us makes it more likely for us to share. You know, you would see somebody tripping over, funny, shocking, however it is, we would share that. So generally it's these fake news trigger greater emotion than the truthful news, right? And the third is this thing of practical value, where, in all honesty, so people would want to share stuff which they think can have practical value for someone else. So why are we seeing so many of these cures being shared, right? Because like a lot of people who would share would genuinely feel that they're helping someone else out, because they're adding this practical value to someone else's problem. And therefore you would share it. So these 3 things make it more likely, and somehow I mean, that's the whole thing within fake news. When you're creating it, like you that's what you see. And in that study, the 3 million, so the 126,000 rumors, what they saw was predominantly lots of emotion from this stuff, from the fake news that was there, and this kind of some value that's in. On solution, so I'm going to put it out. So this is something which is currently, there have been a couple of studies done on this. This is like more this thing of pre-bunking around training you. And this, I would put it under an innovative BI, behavioral insight solution, or a nudging solution, where the idea is again on inoculation, where you give a vaccine to people to cure this infodemic kind of a thing. And the way that they do that is it's a game that you have to play. It's active learning. I'm sure you will have lots of objections to this, fair enough. So this was researchers at Cambridge who did this, in which you're in that game, your task is to use the techniques that are being used to generate fake news. So it's a low dose vaccine in which you have to create, you will gain points actually if your fake news sounds more credible, etc., in that game format. But somehow by these players using techniques which are out there, people know these techniques, but by using them, this was with the 15,000 people that did, it actually made people recognize after playing the game the source that was more reliable, so messages that were more reliable. So I think somehow this kind of an active learning inoculation against fake news is that's one thing which from the behavioral science domain that I know has been shown to work.